Good afternoon. We thank you for joining us today for this special announcement. Through their numerous financial gifts, Jimmy and Marsha Gibbs have served as catalysts for improved cancer care in our community. Today, they're at it again. Their vision and treasure created an endowed chair of cancer, leading us to recruit a world-class researcher, Dr. Timothy Yateman from the Moffitt Cancer Center. In short order, Dr. Yateman has increased our bench and translational research capabilities and has been quietly, until today, worked with more than 100 hospitals to launch a revolutionary clinical trials research program. We broke him away from his practice to spend a few minutes with you today. After a gift presentation, Dr. Yateman will provide more information on the National Research Initiative, and we have some printed media materials for each of you to take with you. Additional questions can be directed to our media personnel afterwards. This is our first public announcement on the project, and there will be much more to come in the future as we continue this groundbreaking initiative. Let me introduce Mr. Jimmy Gibbs for a few remarks.
Thank you, Bruce. As some of y'all, or most of y'all know, this has been a journey that Marsha and I have been on for almost 20 years. It started with Jay Beard and Julie and Joseph. We have been not only given our money and but we've given our time and our efforts to basically prevent and cure cancer. We were very fortunate about a year and a half ago to recruit Dr. Yateman here to Spartanburg, and it was the whole idea at the time was to create what we're going to call the Gibbs Health Institute. It's going to probably be initially a $25 million goal. Marsha and I, to get it kicked off, we're going to pledge $250,000 initially. I'm sure that's not going to be enough for Jay Beard and Julie and Josie, but we're going to give to get it started $250,000, and I have a check here today. It's usually signed only by Marsha, but it's by me today. But $250,000 to Tim Yateman. Thank you very much.
Thank you. Thank you very much. Thank you very much.
Let me introduce you to Dr. Timothy Yateman.
Well, thank you very much, Mr. Gibbs. It's a real pleasure for me to be here this afternoon to briefly tell you a little bit about this groundbreaking initiative. This initiative that we're starting, we're calling the Gibbs Health Institute, is one of a kind. Quite frankly, it's truly novel, truly innovative, and it's all about the patients. We, in fact, are going to try to do two things with this initiative that have never really been done before. And the first thing is to, quite frankly, revolutionize the drug development process. As we know it today, drugs are developed in a very slow, very expensive fashion, and consequently there's over 1,000 drugs today that are bottlenecked in a very difficult to bring to market situation. The problem is the drugs don't get to the patients, and what we're trying to do is bring the drug trials to the patients instead of asking the patients to travel to drug trials. So we're going to have a paradigm shift in the way drugs are developed in this country, and it starts right here in Spartanburg. The problem is that most patients can't get access to the cutting-edge drugs that are offered in clinical trials, and these drugs are the drugs that are targeted, and these laser guided drugs effectively that for the first time might be offered to patients in Spartanburg or in communities like ours. In the past, they've only been offered to comprehensive cancer centers or tertiary cancer centers where patients have to travel hundreds of miles to get access. So by bringing these drug trials to our community, we will not only improve the number of drugs that get out there, because 80% of cancer care is delivered in communities like ours, so lots of patients could now get access to trials because we're going to bring the trials here instead of making the patients travel. The second thing we're going to do is to democratize the clinical trial process. And what that means is we're going to bring trials to patients who couldn't otherwise actually get access to them. So minority populations, impoverished populations, rural and elderly populations that can't afford to travel today will for the first time be able to get access to these cutting-edge, leading-edge therapies. So we think this is a very novel project. We will do it with novel approaches that involve electronic medical records, sophisticated data warehousing, finding real-time data on patients so that we can identify patients in real time, who's available, who's not available, and find those trials for them in the short period of time it takes to do that. Patients have a very short window of opportunity once they're diagnosed with cancer, particularly advanced cancer. And so we must move very quickly to bring these trials to them. So in order to do this, we have to build a huge nationwide network so that we can attract big pharma to this network. And we want big pharma to come and invest in Spartanburg. We want to bring new jobs to Spartanburg. We think this project may ultimately create up to 100 jobs that are high-paying technical jobs. So this project has far-reaching effects that not only it starts with the patients, but it ends with the community here. So I think we're, again, very pleased that the Gibbs family has once again stepped up to the plate and initiated this project, and we're very excited to see how this project unfolds in the future. And I will be speaking with the press in the future as new events happen. We think this is a ongoing, living project. Every week we're putting together a jigsaw puzzle of very complicated approaches that will allow us to do something that's never been accomplished before. So you hear a lot more about this project in the future, but I thought I would give you a real sort of summary of that today. So thank you for coming today, and I look forward to speaking with you in the future. Thank you very much.